How can we make an online paramedic class more interesting? Better yet, how can we make it more like what they will see on the job? The answer to both questions is to go from this to this. Yes, we're talking about using videos instead of written scenarios that they would have to read to get the same message across. We've all heard the expression that a picture is worth 1,000 words. So what does this picture tell us about this person? When you first look at this picture, it looks like somebody might be very sad or upset about something. It doesn't really tell the whole story. Let's add motion to it. What does that tell us? Not a whole lot more. So let's add audio.
I'm at Santa Monica Beach, and I'm just so happy.
Has your impression of this picture changed now that we've seen that 5-second video clip with the audio? How much would we have had to write down to get the same message across as we were able to obtain in just 5 seconds on video? Under the current process, students will go into their Blackboard and pick out a category. In the category, they would select a case study. Once they open up this case study, they're going to read through the information, and based off of what they read, they're going to treat the patient accordingly. The problem with this is that we actually have to feed the students pretty much all the information, and they have to picture it in their own minds what the patient would look like and feel like. Plus, we're giving them so much information that they really don't have to think so much about how to treat the patient, because we kind of really pretty much tell them what to expect, rather than have them look at the patient and then make the determination based off of what they see. So with this new system would allow the students to not only see the patients, but be able to treat them according to what they see. So let's look at what this would look like.
Your services are needed at 180 Forest Avenue for an unknown medical. Timeout is 08:45.
Now that the students have the dispatch information, they can start thinking about how they're going to treat this patient once they arrive. The dispatch information was purposely vague to allow the students to do the full assessment of the patient to determine the patient's condition and medical problem. The other information we normally put in the scenario for the students is the time of day and the weather conditions, so they can start thinking about those things as well.
I'm just not feeling very good. I haven't felt good for a half hour now, and I'm weak. I just can't get up. I just got nothing. Something's going on, and I'm not doing good at all. Help me.
So now how would you treat this patient now that they've become unresponsive? Now instead of the student looking at a piece of paper to get their vital signs, they can look at what they're used to seeing is a cardiac monitor, where they can see all the information they would normally have available to them on a real patient in the field, including the patient's pulse, respiration, heart rhythm, blood pressure, respiration rates, and temperature. And now with that information, as well as what they saw in the video clip, they can now make the decision to treat the patient. To aid the students in their process for decision making for treating this patient, we can show them different rhythms and how these rhythms interact. And if they don't treat the patient accordingly, they can see what happens as well. The patient they should be treating here is for a patient with sinus bradycardia. We can show them what the sinus bradycardia looks like and how the conductive system works through the heart. So if they don't treat the patient properly, we can also show them what could happen and how the patient could deteriorate into a worse condition like complete heart block or even VFib. Now that we provided all this information for the students, they would submit their treatment plan for this patient. And we would give them feedback to see if they follow the procedures according to the American Heart Association's guidelines to treat a bradycardic patient. And if not, we could show them the proper way of doing it and give them some feedback on that as well. They should have been able to know to treat this patient with a medication called atropine, Atropine is used to increase the heart rate that any good paramedic would know how to do. If the patient was too symptomatic that they could not use the atropine, or the atropine did not work, they would know that the next step would be to use pacing for the patient. And they should know how to set the monitor as well as the rate to accomplish that procedure as well. We could use these same monitors that we showed earlier for the patient, that if they did a good job and the patient was responding properly, that their vital signs improved accordingly, as we can see on this monitor. If the student did not treat the patient properly, we could show them on the monitor how the patient's condition would deteriorate. Then we can remediate the student on the proper way of treating the patient. Compared to what we used to do, using a piece of paper and having them read the scenario, I believe this will give us a much better way to show the students the proper way of doing these skills.
The heart is a muscle that contracts in rhythmic
The next step would be to
sequence
show
for the
a short
duration of our
video
lifetime.
explaining what
Each beat
they
is
are actually
stimulated by
treating.
an electrical signal that is generated by the heart's conduction system. A normal heart beats 60 to 100 times per minute. Sometimes, a problem with the conduction system causes the heart to beat too fast, too slow, or to have an erratic or irregular beat. A test, called an electrocardiogram or EKG, can measure and record the heart's electrical activity. In a normal heartbeat, the heart signal follows a specific pathway through the heart. The signal begins in the sinoatrial node, or SA node, located in the right atrium. The SA node triggers the atria to contract, pushing blood into the ventricles. The electrical signal then travels through the atrioventricular node, or AV node, and into the ventricles. This signal now causes the ventricles to contract, pumping blood into the lungs and body. If the signal becomes delayed or blocked, a condition called bradycardia can develop. Bradycardia, which is more commonly called sinus bradycardia, is a type of arrhythmia in which the heart beats fewer than 60 times a minute, an abnormally slow rate. Most people with sinus bradycardia are asymptomatic. However, in many patients, bradycardia can produce symptoms such as dizziness, weakness, or fainting. These symptoms result from a decrease in the circulation of oxygen-rich blood to the body, especially due to the decrease in blood flow to the brain. Bradycardia can also be the result of heart disease, or it may have no identifiable cause. Treatment for bradycardia may include medication, or in severe cases, the insertion of a pacemaker.
What we've seen up to this point so far is illustrating how we could use this for a medical call. We could also use this same process for a traffic or a trauma situation as well. In this video clip here, the students could look at the video, make the determination on the scene safety, how they'd approach the scene, some of the things they can be concerned with the patient's condition, or any other types of things that we'd want them to look at. As you can see, this overall process of using videos instead of written documentation or paper to explain the scenario gives a much better opportunity for the students to use critical thinking skills. I also believe the students will enjoy the refresher much more than just having to read something and trying to treat a patient according to what they read on a piece of paper. This entire presentation was created in a program called Camtasia, which is a very easy program to learn how to use. We'd use this program to create the videos, put them out on Blackboard, replacing the files we currently have out there for the students. Thank you for your consideration of this new way of teaching a refresher class online.